Prescriptions for ADHD treatment surged during the COVID-19 pandemic, CDC report shows. CNN prescriptions for stimulant often used to treatment attention deficit hyperactivity disorder surged during the pandemic, especially among adults, the new study found. The finding comes as one common ADHD treatment, Adderall, had been in shortage for months, in part because of high demand. Diagnoses for ADHD have become more common in recent decades, and the prescriptions for stimulant drugs that are most often used to treat neurodevelopmental disorder have also been on the rise. But the new report from the U.S. Center for Disease Control and Prevention highlights a recent surge in demand for the drug and others like it. Between 2016 and 2020, the share of the population that had filed the prescription for a stimulant drug held relatively steady. But there was a large increase in 2021, with the prescription fills jumping more than 10% across the most age groups. Overall, the CDC analysis for private insurance record shows that more than 4% of people ages 5 to 64 had filed a prescription for the stimulant in 2021, up from 3.8% in 2020. The vast majority of people who are prescribed stimulant medications have a ADHD diagnosis or are being treated for symptoms of the disorder. ADHD typically identified in childhood and have been more prevalent among boys, and CDC analysis found that stimulant prescriptions were constantly most common among boys ages 5 to 19. However, the largest annual increases in 2021 were among adults, especially women in their 20s and 30s. There are well established clinical guidelines for ADHD care for children and adolescents, with the outline of symptoms that show the persistent pattern of inattention or hyperactivity impulsivity. While there is a growing recognition of ADHD in adults, the comparable playbook for adults does not exist. The gap in guidance for adults is a public health concern, in part because of the general inadequate access to mental health providers trained to diagnose and manage ADHD, according to the researchers. Development of clinical recommendations for diagnosing and managing adult ADHD could help guide safe and appropriate stimulant prescribing, they wrote. While stimulant can offer substantial benefits for people with ADHD, there are also potential harms, including misuse and overdose. Nearly 33,000 people died from the overdose involving a psychostimulant in 2021, CDC data shows. Methamphetamine is the primary drug involved, but deaths have nearly doubled since 2019. The sharp rise in prescriptions for stimulant during the pandemic also raises questions about the role of telehealth. Expanded access to telehealth during the pandemic could help remove the barriers and encourage more people to seek care, especially during a time when mental health struggles were exacerbated. But it also could have introduced greater potential for inadequate evaluations or inappropriate stimulant prescribing, according to the researchers. Evaluation of policies enacted during the pandemic could identify benefits and harms of those policies, they wrote. Some people who use stimulant for ADHD have struggled for months to fill their prescription. The U.S. Food and Drug Administration announced the shortage of Adderall on October 12, 2022, the agency noted that it was in communication with all manufacturers of amphetamine mixed salt, and that one of those companies was experiencing ongoing intermittent manufacturing delays. Although the other manufacturers continued to produce the drug, the agency said there is not sufficient supply to continue to meet the US market demand through those producers. Jim McKinney, the spokesperson for the agency, told CNN last month that the manufacturing delay had been resolved and that the shortage is now demand driven. On its website, the FDA lists 8 manufacturers that have reported other shortages to the agency. The website listed the shortage region for some versions of the drug, such as demand increase or shortage of active ingredient. But for other versions, it just says other or lists no region at all.